Joe Elvidge is the new Principal Advisor of Sexual and Reproductive Health at the Ministry of Health. Joe has 20 years' experience in the health sector and 12 years with the Ministry of Health. She has established and led national public health programmes in sexual health, violence prevention and workforce development. And she's here to talk to us today about the way forward. Thank you, Joe.
Inga mana, e ngā reo, e ngā karanga maha e hui hui nei, tēnā tātou katoa. I want to really thank the people of Tainui for welcoming us here to the rohe and welcoming us to be together in the conference and make it count, and to Jane and Alison and the Sexual Health Society for inviting me to come along today. So look, today this is the beginning of a new relationship. So I'm just going to be getting to know you. So I want to talk to you a bit about who I am. I want to talk to you about the role, and I want to talk to you a bit about kind of some of the inner workings of the ministry that you might find enlightening and interesting, because I'm aware from one or two people that sometimes their relationships with the ministry can be a teeny bit frustrating. So let me just figure out how this thing goes. So here we go. Okay, so firstly I'll start with my role, which is basically providing a point of contact for the sexual and reproductive health sector, for the ministry, for the minister, and across government from basically all things sexual and reproductive health. In particular, it'll be looking at keeping sexual and reproductive health visible and increasing the mandate and providing some leadership. There's a fairly broad remit, so it includes STIs, HIV, sexual diversity and homophobia, infertility, access to contraception, sterilisation, termination, endometriosis apparently. Okay, I'm not a clinician, so you clinicians out there, I'm wanting to put together a bit of a clinical network because we're going to need that. So the last few months I've been really busy getting to know what goes on in the ministry. It's a really busy place, and there's lots of people who are doing things that can apply to sexual and reproductive health. So most recently we've been working on the BIMS, which is the briefing to the incoming minister. So been working hard to get a good sexual and reproductive health part of that. I didn't know this, but there is a main BIM and there are secondary BIMs. I'm assuming the main BIM is the most important and strategic stuff. I haven't seen it. And then the secondary ones is kind of everything else. Thank you. Okay, very good. I wondered what that was doing there. It's telling me what's on the slide. And then we have a master plan, which is to produce an action plan, the one that we've been waiting for since, I can't remember, was it 2000 or 2001, for sexual and reproductive health. So I want to talk a bit about what we need to do to really get that to fly. But I guess the main points in there is that, we need visibility, we need advocacy, we need to be well networked, we need to have great data. Anyway, just introducing myself. Live in Auckland, partner, couple of kids and a stepson. My big girl is 14, so I'm obviously testing out everything sexual and reproductive health on her. Fortunately, she's quite willing to engage in the conversations. She was a bit worried when I was bailing up the health teacher about how much time they're giving in the curriculum. But anyway, I sort of backed off a little bit. So my first ever job was in family planning as a sexuality educator, which sort of whet my appetite for all things sexual health, and I spent quite a lot of time wheedling my way back into sexual health again, and persuaded my bosses at the ministry to give me a bunch of contracts to manage. So that was a fantastic experience, really getting to know a lot of the data, coming into grips with gaps and GOS studies, which I've always found utterly fascinating, and they always made my brain go, oh, we should be doing this, we should be doing this. And FGM, which is, Nikki doesn't usually come to these, I think, does she? I don't know, maybe you don't know her. Amazing work done in female genital mutilation, just really awesome stuff. And Te Kahua Te Rangatahi, also amazing work, peer sexuality support program. And then I worked a bit, Minister Turia asked us to do some work on improving sexual and reproductive health for rangatahi, so I wrote a bit of a plan. Not entirely sure how much of it's happened, but anyway, we wrote a plan together with Manaya and Nairi Sandel, who most of you know, who's somewhere here in this audience. You could wave, Nairi. Oh, you're trying to sit at the back. There you go. There she is. I'm sure most of you know Nairi. But the reason that I really wanted to go back here is because of this workforce. And this is a quote from the the Value for Money report that you haven't got yet. But this was why I wanted to work in this field, because sexual health people are stunning people, and all of the things that are said here are really, really true. And I think you've all achieved amazing things in this time. I was thinking just things like the fact that we have a legislative framework that legitimises and validates sexual orientation. I mean, it's a critical basic human right, and it's really important for wellbeing. And I was reflecting from my family violence work how much law always leads culture. You know, the law sets the framework, and then opinions slowly change. I was thinking about us being a low prevalence HIV country, and that's 20 years more, isn't it? 30 years of work by AIDS Foundation, Prostitutes Collection, needle exchange programs, and I think, isn't it, Sean, correct me if I'm wrong, isn't it something like 80 to 85% of gay men regularly use condoms? I mean, that's an amazing statistic. That's a huge, huge achievement. Data, finally. We've got much better reporting data on STIs, which is a lot of your work. There's a whole bunch of stuff. STI primary care guidelines, I think the family planning work that you've done in setting up phone access. I saw Talanoa, done by the Village Collective, which is an amazing piece of work, making a space for young Pacific people to speak freely and openly about sexual health. I saw Theta, which is Theatre and Education, which was went through everything sexual health in like half an hour. So it was a bit like being the surf at Piha. It was kind of dizzying, but kind of exhilarating at the same time, and pretty funny. I think they did a barbershop quintet to GLBTI, which was kind of impressive. And then I think the other bit of work is connecting up the sexual health and the reproductive health sectors. And when I was working in violence prevention, this was quite a similar sort of project to this, in the sense that the health sector was not engaged actually at all in violence prevention. It was a criminal justice problem, and we had to get sort of child abuse, child rights advocates working with the mainly feminist partner abuse workforce, and pull together a single protocol, which we did. And so I think that one of the other things is about being really well networked, and we're a smallish sector. We need to be really well networked and work well together. So there was a lot of world leading work down there, a lot of firsts. But anyway, getting back to the main topic, which is developing world-leading universal evidence-based, which I'm calling WLUB, sexual and reproductive health services. Because the dreaded Value for Money report and the Health Select Committee report on, I think it's, what is it, preventing child abuse and improving child health outcomes with a focus on preconception up to 3 years of age. Nifty title. Basically, they both said the same thing, and so one of the things that we will do is put those up. And that actually was fascinating to me that they both said the same things, because they had quite different kind of remits. One was really looking at welfare of children, and the other was looking at the whole sexual and reproductive health sector, but they actually came up with the same recommendations, except for the bottom one, which was only in the Health Selection Committee report, and there was about 6 recommendations on that. But I think that gives us a really good grounding to be able to make a case. I think I have to finish, so where are we? I think this is what we're trying to do: have compelling data, get a mandate, get an action plan, keep our networks and collaboration going. I just did want to mention that I know that there's been a little bit of anticipation about what might happen in this role, and I just wanted to say that obviously there are some similarities between superheroes and ministry staff. The dress sense, I know you're going to say. No, it's actually the scale of our ambitions, I think. But there's also some really important differences, and that the most important one is that superheroes move fast. So, in conclusion, I just want to say that I'm really excited about working with you. I really invite you to come and talk to me about your work, because I'd like to learn more about it. Bail me up about things you're grumpy about the ministry up, that's fine. I'm quite happy to hear about it, and happy to do something if I can. But the big thing, I think, is that if we're moving forward, we're going to do it together, and that we've all got different places to stand and all got different abilities to push different parts of the system to get things happening. That's all. Thank you so much.